Hey everyone, and welcome. In medicine, the difference between the right word and the almost right word can literally be the difference between a correct diagnosis and a critical mistake. Precision, it saves lives. So, in today's explainer, we're not just going to know some medical terms, we're going to master them, really elevating your clinical language from just being proficient to being truly professional. Let's dive in.
So let's start with a question. What's the real difference between balance and homeostasis? Well, one is a pretty general idea you might use with a patient. The other, that's a precise physiological state you document for your colleagues. One is kind of vague. The other is actionable. And trust me, getting this distinction right is absolutely fundamental for accurate diagnostics, clear communication, and safe patient handoffs. And that's exactly what we're going to focus on today. First, we'll get a handle on 4 essential terms that are really the pillars of physiology and immunology. Then we're going to put them to work immediately, learning how to weave them into the kinds of complex, fluent sentences that show real professional mastery and bring total clarity to your clinical notes.
Okay, let's start with that invisible world inside the body. Our first two terms, interstitial and homeostasis, are absolutely critical for describing a patient's internal state. Understanding these is the key to diagnosing everything from simple swelling all the way to life-threatening shock. First up, interstitial. It comes from the Latin for to stand between, and it's all about the fluid-filled spaces between your cells. Now, this isn't just empty space. It's a supercritical, dynamic zone for nutrient exchange, waste removal. And from a clinical standpoint, it's where signs like edema, swelling, first become visible. To really nail this down, just look at this comparison. The synonym intracellular is pretty similar, but the absolutely crucial clinical distinction is with its antonym, intracellular, meaning inside the cell. So why does this matter when you're on your rounds? Well, because a virus that's replicating intracellularly is literally hiding from the immune system, whereas a bacterial infection might be thriving in the interstitial fluid. That location dictates your entire diagnostic and treatment plan. And here's where the rubber meets the road. When you press on a patient's swollen ankle and see that classic little indentation, that's pitting edema. You are directly observing a failure to clear excess interstitial fluid. So in their chart, you wouldn't just write swollen ankle. You document pitting edema due to interstitial fluid accumulation. That's the level of precision we're aiming for. Okay, our second key term is homeostasis. It's from the Greek for similar and standing still. And it's the body's dynamic process of maintaining a stable internal environment. Now, this is not some passive balance. It's a constant, active state of adjustment. In fact, you could describe nearly every single disease process as a disruption of homeostasis. Now, while equilibrium is a decent synonym, the word that truly matters on the hospital floor is the antonym, instability. Think about it. Volatile blood pressure, fluctuating glucose, erratic heart rhythms. These are the markers of physiological instability. This is the giant red flag that tells you homeostasis has been lost and your patient is in real danger. So let's connect our first two terms. A patient with congestive heart failure is experiencing a loss of fluid homeostasis. And what's the direct result? That interstitial fluid buildup we just talked about, which you observed as pitting edema. See how that works? Your job as a clinician is to see that connection, identify the instability, and then figure out its root cause. All right, we've covered the internal environment and its delicate balance. Now let's shift gears to the language of conflict, the vocabulary we use to describe the body's constant battle against pathogens. Here, we're going to tackle virulent and counteract. Virulent. This word comes from the Latin word for poison, and man, is it a powerful descriptor. When you describe a pathogen as virulent, you're signaling that it's aggressive, highly infectious, and poses a very serious threat. It's a term that immediately, and appropriately, escalates the level of clinical concern. Let's refine that just a bit. Malignant is a strong synonym, right? It shares that sense of life-threatening aggression. But its antonym, innocuous, is just as important. In a lab report, distinguishing between a virulent and an innocuous strain of bacteria is the difference between starting immediate, aggressive antibiotic therapy and simply monitoring the patient. Huge difference. Okay, let's imagine your patient, a 65-year-old admitted with pneumonia. The initial lab report comes back and you see that one word, a virulent strain of bacteria has been identified. Instantly, your entire care strategy shifts. The risk of sepsis is now high, you're going to choose a more aggressive IV antibiotic, and you'll increase vitals monitoring from every 4 hours to every 2. That one single word, virulent, changed everything. So, when faced with a virulent threat, what does the body do? It tries to counteract it.
It comes from the Latin contra, against, plus act. This is the action verb of the immune response. The body doesn't just sit there and endure an attack. It actively fights back to neutralize the threat.
And the process is a pretty clear sequence. First, a threat invades. Second, the immune system launches a targeted action to counteract it. And what's the final goal? It's always resolution. Neutralize the threat and restore that all-important homeostasis we talked about just a minute ago.
And you know what? This is the very mechanism behind immunity and vaccination. We expose the body to a harmless version of a pathogen to train its adaptive defenses. Why? So it can rapidly produce antibodies to counteract the real threat if it ever invades. It's pretty amazing.
So we've mastered the vocabulary. Now for the final and maybe most important step, application. Let's move from just knowing the words to using them with real C1 level fluency. This, right here, is where competence becomes true professionalism in your clinical notes and reports. Take a look at the screen. You see 3 simple facts. The thymus shrinks after puberty. It is smaller in adults. It remains critical. Okay, this is factually correct, but it's choppy. It doesn't have any analytical depth. It reads like a list, not a professional assessment.
Now here's the C1 upgrade. 1 fluid academic sentence. Did you notice the power of that word although? It's not just listing facts, it's showing analytical thought. It shows you understand the complex relationship. The thymus shrinks, yet it's still critical. This is the kind of concise, comprehensive notation that's expected in professional medical records.
All right, let's lock this in with one final exercise. We're going to take some common, everyday B2 level descriptions and upgrade them into the precise C1 level clinical statements you should be using in every single patient chart and case presentation. Look at this first example. The body tries to keep a balance of fluids. It's not wrong, but it's really vague. Now compare that to the physiological systems work in tandem to maintain fluid homeostasis. You see, this version is active, it uses our precise term, and it just conveys a much deeper understanding of the physiology involved. And one more. The doctor gave a lot of tests. That's how a patient might describe it. You, as the professional, would document, the physician administered a battery of tests to facilitate a diagnosis. Using standard phrases like battery of tests instantly signals professionalism and clarity to any colleague who's reading your notes. And listen, this isn't just about sounding smarter. This is about creating crystal clear medical records that prevent errors during handoffs and ensure every single member of the care team understands the patient's situation precisely. This is where language truly becomes a tool for patient safety. So let's bring it all home. We've defined 4 critical terms: interstitial, homeostasis, virulent, and counteract. And more importantly, we've seen how to build them into the sophisticated sentences required for top-tier clinical communication. I'll leave you with this question on your screen. What's one technique you can apply today? Are you going to swap balance for homeostasis in your next report? The path to excellence is really built on these small, deliberate improvements. Start making them now. Thanks for joining me.